All right, good afternoon, everyone, and thank you for joining the presentation today. I currently work at the Maryland Proton Treatment Center, which is affiliated with the University of Maryland Medical Center as a medical dosimetrist, but I previously worked here as a therapist for 4 years. So today I will be mainly sharing my experience from performing many SDX practice training sessions and SDX CT simulations, and then also delivering SDX treatments as a therapist. And so I'll just be providing some tips and suggestions from things that we've learned over the years of treating patients with using the SDX technology. So I'll go ahead and get started. For disclosures, I have been invited by DYN'R to give this presentation. A little bit about the Maryland Proton Treatment Center. We are a 5-room facility, so we have 4 gantries and 1 fixed beam. We've treated about 230 SDX patients, and we have purchased 2 SDX systems where we keep 1 mainly in our CT simulation room, and then 1 SDX system on our treatment floor. We really have 1 room that we designate to treating our SDX patients, but if for some reason that room is not working that day, we can transfer our SDX system to our other treatment room, which is equipped to deliver SDX treatments as well. So just an outline of what I will be talking about today, I have it broken down into 3 main sections. So beginning with the SDX patient coaching session, where I'll be discussing how to determine if a patient is a good SDX candidate, how to effectively explain and prepare a patient to use the SDX technology, and then finally designating the patient's breath hold level. And then for the next category, it'll kind of be the CT simulation. So how to obtain a breath hold CT simulation scan with using the SDX technology. And then finally, radiation treatment delivery using the SDX technology. So how to appropriately position a patient and the SDX devices for treatment delivery, and how to coordinate obtaining images and delivering treatment with the patient in breath hold. So a little bit about what SDX is. SDX is a spirometric voluntary breath hold system for patients undergoing radiation therapy. It can be used at photon or proton clinics. And I'll just highlight the word voluntary because there are some other breath hold systems out there that kind of force a patient to hold their breath and stops them from breathing. But this SDX system is completely controlled by the patient. So the patient can decide when to hold their breath and when to breathe. And SDX is a really great option for any tumor susceptible to breathing motion. So tumors located in the lungs, pancreas, liver, esophagus, and then just the more general areas like tumors located in the abdomen or thorax. And then just beginning with how we kind of schedule a breath hold CT simulation and our workflow process with that. The patient's primary radiation oncologist will decide during the consultation if a breath hold CT simulation is necessary depending on a few factors. So the first is the location of the tumor. Like I mentioned on the last slide, if the tumor is located in an area that could possibly be susceptible to breathing motion, that would be a reason why a doctor might request a breath hold CT simulation scan. Then the doctor will do a physical assessment of the patient's condition. So for example, they might take into account factors such as the patient's age. If they're too old, then they might not be an ideal candidate for SDX, and then also might just take into account some of the patient's underlying conditions. So if the patient has asthma or difficulty breathing, they might not be an ideal candidate either. And then typically our physicians will do a simple breath hold test of the patient holding their breath for 30 seconds. So that certainly doesn't mean that the patient will be able to do that for us as the therapist during the practice session, but at least the doctor can get an idea if the patient could hold their breath for 30 seconds for them. And if not, then it just might not be worth the therapist's time to try to do an SDX practice session if the patient's not even able to hold their breath, just sitting up and kind of in an ideal condition. And then finally, if the physician determines that they think the patient could benefit from a breath hold CT simulation, the physician will contact the CT simulation scheduling therapist and request an SDX practice session. So currently at our center, we schedule every patient in 1 hour CT simulation time slots. And then if an SDX practice session is requested, we will schedule the patient in an additional 1 hour time slot. So our SDX patients are always scheduled for CT simulation in 2 hour time slots. So beginning with SDX quality assurance, I'll just go over the process briefly here, but this does need to be done every day before using the SDX equipment, and it is equipment specific. So you'll want to warm up your SDX device if you're using it for treatment, which we pretty much always have an SDX patient under treatment. So we will warm this up on our treatment floor pretty much every morning. And then you will also warm up your device in CT simulation if you have 2 SDX systems. But we really only warm up our SDX device in sim if we have an SDX sim patient on for the day. But just beginning with the process here, you will perform the daily QA calibration check by clicking on the syringe icon. So it's that white button there. This is just to ensure that there's no signal drift and that the calibration parameters are still valid. And you will ensure the calibration check stabilization countdown reaches 0 before beginning the QA process. This takes approximately 5 minutes. So you can see from the picture that I have included on the middle that the stabilization bar has turned green and that it has reached 5 minutes. But before it reaches 5 minutes, it'll just be counting up from 0 and the bar will be red. And then you, at this time, while you're waiting the 5 minutes before beginning QA, you can just securely attach the white 3-liter calibration syringe to the SDX module. So on the SDX software, you'll go ahead and click the play button and the program will say, please perform the calibration check. You will begin by moving the syringe handle in and out, and you want to complete at least 4 cycles to validate the check. So you want to bring the syringe handle all the way out to where that red line reaches the hash mark of 3 liters on the side. And then you want to push the handle all the way in to that red line touches the light gray graticule at the bottom. And then the software will stop and calculate the volume, so you can just give it a minute. But some more technical things that it's looking for here is that it wants the inspiration and expiration volumes to be within plus or minus 2%. And if it doesn't pass, you can go ahead and repeat it. It doesn't take that long. You do not need to wait the 5 minutes again. But if QA continues to not pass, you might just want to contact physics and your SDX system just might need to be recalibrated. But when SDX does pass QA, the program will say calibration check successful, and then you know you are ready to go and start treatment. So then preparing for the breath hold CT simulation, whenever your patient comes into your CT simulation room, we always kind of begin this process just like we would any patient. So you want to first make your immobilization devices around the patient and position them in the position that they'll be in for treatment. At this point, we go ahead and we place our localization marks, so our baby's on stable anatomy. And we also acquire our CT topograms to make sure that the patient's in a straight and desired treatment position. So this is kind of up to your discretion as a therapist. Sometimes we do repeat the topograms again right before we do the CT simulation, but at least this is our way of kind of ensuring that we have the patient in as close of a position as possible to what they will be in for treatment. Because whenever we are doing the SDX practice coaching session, we really want to be kind of simulating the environment that the patient will be in for treatment as best as possible. And then the only thing I would recommend is that we normally put our SDX device on the CT table And that's before we make the vac lock. So we can kind of mold the vac lock around the patient and the SDX device because of course we need the device to sit above the patient's head during treatment. So this is just kind of our way to ensure that we aren't going to run into any issues during treatment with properly positioning the SDX device above the patient's head. And then it can kind of sit on your table correctly and not have any issues with running into the vac lock. Now kind of beginning the SDX practice coaching session, I just think it's very important to make sure you explain all the components of the SDX equipment to your patients as best as possible. Otherwise, it just looks like a lot and they can become overwhelmed by all the equipment. So I first begin by giving the patient the mouthpiece and asking for their lips to form a tight seal around the mouthpiece. The best tip I have for this is if the patient has ever been snorkeling, this is a pretty similar mouthpiece to exactly what you would put in your mouth. So I tell the patients to make sure you put the knobs on the sides of the mouthpiece in between their teeth and to bite down. And then I ask them to form a really tight seal with their lips around the middle of the mouthpiece like this. Next, we will give the patient the nose clip to ensure that air is only going in and out of the patient's mouth and no air is exiting through the patient's nose. I think that this is probably the biggest thing patients complain about in terms of comfort. So one thing that we found is that if you place a tissue or a piece of gauze under the patient's nose, it can help with the patient's comfort. And finally, we just kind of explain this last piece here, which is the goggles that go over the patient's eyes. A tip I have for this is that you can use the focusing knob that is on most of the SDX glasses to adjust for patients who are near or far-sighted. Of course, if your glasses don't have the focusing knob, or if you can't get the glasses into focus where the patient can see the computer screen accurately, the patient can wear their glasses underneath the goggles. But at this point during the coaching session, we actually just connect the mouthpiece and the nose clip, but we do not give the glasses to the patient at this point yet because we don't really need them to see the computer screen at this point. So beginning the SDX practice coaching session, I kind of like to break this part down into two major parts. So for the first part, we are trying to obtain the patient's maximum lung capacity and kind of assign a value to that. So what we'll do is have the patient take a deep breath in and hold for a few seconds at their deepest breath level. And then we have the patient do that 3 times. And then the second part of the practice coaching session is having the patient hold their breath for a few different periods of time. So beginning with the first part here, you'll first begin by entering the patient's information into the SDX software, and you want to save it. So you'll begin by entering the patient's last name, first name, date of birth, and patient ID number. So we use the patient's hospital ID number, but really any patient-specific identifier will work. And then you'll begin by clicking the button labeled preparation. So this is the top button in the middle. And again, this is just the part where you will have the patient obtain a deep inspiration breath hold. And so at this part, with beginning the patient coaching session, I would just recommend make sure that you're in a position as a therapist to effectively communicate with the patient. So we have our SDX computer on a portable cart that we can kind of move around our CT sim room. But if you don't, that's okay, but just make sure that however you're going to coach the patient, it's feasible for them to feel that they can communicate with you adequately, because nothing's worse than them just not really understanding the system and them not feeling like they can ask you questions or that you can hear them and that they can hear you. So for me, I always bring the laptop right beside the patient as they're laying on the CT simulation table in treatment position, and just make sure I'm right beside them so that they can hear me and effectively understand what I'm trying to communicate to them. So beginning with having the patient take 3 deep inspiration breath holds at their deepest level, you'll begin by clicking play and having the patient breathe normally for a few cycles. So this is how you will always begin anytime you begin the SDX program. It just kind of allows the SDX system to understand the patient's normal breathing level. But when the SDX program is ready, the program will alert the therapist by displaying this text box that says ready for measurement. Then you can go ahead and tell the patient to take their deepest breath in that they can and have them hold for about 2 to 5 seconds. Then you can hit the stop button, and this will allow the program to generate a value associated with the patient's maximum lung capacity. And then again, you just want to repeat this process 3 times to kind of get an average of the patient's maximum breath hold. So after doing this 3 times, you'll see a square box at the bottom of your computer screen with 3 test values. So you can see from my picture in the bottom left hand of the screen, in the row that says respiratory capacity, I have 3 different test values. So what we normally do is that we either take the average of those 3 numbers, or you can just take the middle number, or if one of your test values is extremely high or extremely low, you can just kind of disregard maybe that and kind of call it an outlier because it probably just isn't an accurate number. And you can kind of just focus on the other 2 numbers that are closer together. But what you'll do whenever there's a number that you like or a number that you think is probably a good representation of the average, you can just double click that number, and that will generate the maximum respiratory capacity that you consider the average. Then you will click the % button, which will generate a number that's 75% of the patient's respiratory volume. So during the CT simulation scan and during treatment, we've actually decided that we don't want the patient to hold their breath at the deepest level, because oftentimes that's pretty hard for patients to hold their breath at the deepest level for all of treatment or all of imaging. So we actually do 75% of the patient's maximum breath hold. This is just kind of a set value, but it also can be adjusted. So of course, if you have a particular patient that 75% for them is just still pretty high, this number can be adjusted. We normally just get our physicist involved, but you can set it to 60% or 50% or whatever your physics team thinks is appropriate for that patient. So you can see on the bottom right of my slide here that by clicking the % button, it generated a number that's 75% of the maximum respiratory capacity. So now that number is 1.78 as opposed to some of the other numbers on the left-hand side of the screen that are like 2.16, 2.09, and so on. And the one piece of advice I have for this is just in case the patient's information during this practice session doesn't save for some reason, we always write this number down, this 75% value number, and document it in the patient's chart. Just for some reason, if it gets lost or the patient's information doesn't transfer to the treatment machine for some reason, this value can be manually entered in, and you don't need to redo this entire practice session process. So next, moving on to the second part of the practice coaching session, where you will have your patient hold their breath for different increments of time. For us, we have the patient hold their breath for 15, 30, and 45 seconds. And I'll get into a little bit later why we chose those increments of time. Of course, you can kind of tailor this according to your clinic and what you think is appropriate. But you'll begin this session by clicking on the imaging button. That's now the middle button on your screen. And at this point, you can go ahead and you can place the goggles on the patient because you do want them to see your computer screen at this point. So this here is what the software view is what you as the therapist will see on your computer. And the goggle view is what the patient will see in their goggles. So if you have the most and latest software upgrade that was released by SDX, you can give the patient the option of viewing this moon animation, where the patient's breathing actually moves up and down with this moon animation. Of course, if the patient for some reason is not understanding that, or they think that that's confusing, you can always switch it back to the software view where they see something similar to what you see on your computer screen, where the patient's breathing will actually move up and down with a red line. And then when it's time for the patient to hold their breath, a green bar will come across the top of the screen where the patient will take a deep breath in and hold their breath within the appropriate margin. But if you use the moon animation, a green circle will appear at the top of that bar, and that will indicate where the patient is supposed to hold their breath. So you'll begin this part of the practice session by clicking the play button. And again, just like anytime you start the SDX program, you want to allow the patient to breathe normally for a few cycles, and then you'll click the middle square button. At the top, it will display the green bar, which is an indicator that the patient can take a deep breath in and hold within the appropriate margin. Of course, if you're using the moon animation, it will be that green circle that you can see there in the picture. And something that I would recommend at this point is that I always tell the patient, anytime that you just see the green bar or you see the green circle, that's an indicator that the system is ready for you to take a deep breath in and hold your breath. But I always tell them to just wait until they feel ready, that there's no rush. As long as they continue to breathe normally, just because they see that green bar or the green circle appear, it doesn't mean that they need to rush into breath hold, because a lot of times patients won't be ready to hold their breath for a long enough period of time. And then the patient will either just have to repeat it or repeat the imaging or things like that. So I always tell them to take their time until they feel ready. And just by giving them that piece of advice during the practice session, that also correlates to treatment as well. So they know that during imaging or during treatment delivery, that as soon as they see that green bar, they don't necessarily need to rush and jump into holding their breath, but they can take their time. And whenever they feel ready, they can take that deep breath in and hold. So for the first part here, like I said, we begin with having the patient hold their breath for 15 seconds. So normally this is pretty simple for most patients to complete, but we still pretty much have them hold their breath for 15 seconds and then allow them to breathe. Just because it does take a little bit of skill and practice to have the patient breathe normally and then take a deep breath in and hold within the appropriate margin, because this green bar or the green circle is associated with 75% of the patient's lung capacity. So it's not necessarily their deepest breath, but the patient has to hold it within this margin in order for imaging to begin and in order for treatment to begin on the treatment floor. So when the patient does get their breath hold into the appropriate margin, a timer will begin that appears at the top of the screen. So you can kind of see there from the picture that there's a counter. I use this to help me know if the patient is at 15 seconds or 30 seconds or 45, depending on which trial run you're on. But some patients kind of close their eyes as soon as they get into the breath hold, because they feel like if they watch the timer, that time just doesn't move. So just make sure that you as the therapist are communicating to the patient. I always let them know when they're at like 5 and then 10 and 15 seconds. And then ultimately I tell them when they can breathe. And so after you do the 15-second trial run, you just want to repeat it again for 30 and 45 seconds as well. So just a few tips that I've compiled together from the SDX practice session, just to dive a little bit deeper into some of the things I just talked about. But just make sure you tell a patient to feel ready until that they feel ready to hold their breath for the desired amount of time that you're requesting, regardless of when they see that margin appear. You want to give patients plenty of time to catch their breath in between the different trial runs. So you don't want to have the patient hold their breath for 30 seconds and then right away jump into 45 seconds. You want to make sure that you give the patients plenty of time, or else you'll probably just be repeating that 45-second trial run if the patient doesn't have enough time to catch their breath. The next point I have is just make sure that you as a therapist are being aware and being attentive to the patient and how they are doing during this practice session. Some patients like to be talked to and encouraged and explained how they can improve. So a lot of physicians, during the consultation kind of really talk up the SDX technology, and patients really get convinced that this is the best treatment for them. So they really want to improve and they really want to get this treatment. So if you as the therapist can just be watching and encouraging them, if for some reason the patient is not passing the practice session, just make sure you're watching them and you can kind of give them advice. Like, for example, maybe they don't have a tight seal with their lips around the mouthpiece. So you want to make sure that you can offer them some way that they can master this technology. And then other patients, they know what they're doing wrong and they just want multiple attempts to get it right. So just make sure, just because your patient might not be able to hold their breath for 45 seconds right from the jump, make sure you give them plenty of time and let them know that they can have multiple attempts to kind of work up to holding their breath for a long period of time if needed. And then the next point I have is just to explain to the patient to take a deep breath in and completely stop any air from coming in and out of their mouth instead of trying to breathe into the green bar. So I'll kind of explain a little bit more of what I'm meaning with this in the next slide, but you really just want to make sure that the patient is taking a deep breath in and completely holding their breath, because that is the point of using this SDX breath hold technology, is to ensure that the tumor is not moving as much as possible. And then the last point I have is just make sure you're watching the patient during these trial runs and making sure that when the patient takes a deep breath in and holding their breath within the 75% margin, that they're not moving significantly. So that will be the level that you want the patient to hold their breath in during the CT simulation scan and also during treatment. So obviously this is still radiation therapy and you still don't want your patient to move. So after you would take your images, it would just not be conducive to what you're trying to do during treatment if your patient was moving slightly out of position every time they take a deep breath in and hold right before the beam turns on. So just make sure, in order to make sure that the patient's a good SDX candidate, that they're holding pretty still when they take their deep breath in and hold. So then how to kind of tell if a patient's not a great SDX candidate. For us, this is kind of getting into why we have our patients hold their breath for at least 40 to 45 seconds, is because we want to be able to have the patient hold their breath for our entire duration of our cone beam CT scan. So really this is clinic specific. So if your specific clinic, your cone beam is only 30 seconds, then maybe you only need to have your patient hold their breath for a maximum of 30 seconds. But for us, we have determined that our best imaging quality can be obtained if the patient holds their breath for the entire duration of our cone beam CT scan. So at this point, I always kind of tell patients, you can actually control your breathing and how long you hold your breath during treatment delivery. But during the imaging that we acquire every day before treatment, we need you to be able to hold your breath for the entire CBCT scan that we will be acquiring. So that is kind of a reason why we wouldn't have a patient kind of pass our SDX coaching session if they're not able to at least hold their breath for 35 to 40 seconds, just because pretty much all of our SDX patients are cone beam daily, and if not, at least cone beam weekly. But we want to ensure that we can obtain the imaging that the doctor is requesting. And then the next reason why a patient might not be an ideal SDX candidate is if they're unable to get a tight seal with their lips around the mouthpiece. So some patients, that don't have teeth, they might have dentures, or some patients just have really weak lip muscles, and that kind of leads to air leaking out of the mouthpiece. And then really the patient is just struggling to get their breath hold within the appropriate margin. So that might be a reason that you can kind of just make that judgment call as a therapist and just kind of know that it's probably going to be a fairly big struggle for the patient to hold their breath appropriately during treatment every day. The next point is kind of like I mentioned on the last slide. If a patient moves their body significantly when taking a deep breath, that would be a reason that you might not want to do SDX. And then, like I was mentioning on the last slide, when the patient's breath hold line in the green bar is not steady. So this is what I was kind of meaning when I said the patient is kind of just breathing into that green bar. For me, I'm kind of alerted that the patient is not really holding their breath steadily whenever that red line is moving up and down. So you really want the patient's line to be solid and straight. And while technically treatment would still deliver if the patient's line was kind of moving up and down because it's still staying within the green margin, that still alerts me that the tumor might be moving slightly because technically the patient is just breathing into that green bar and not necessarily holding their breath. So these are just some of the things you want to watch out for as the therapist during the SDX practice session. But now to wrap that up and move into the breath hold CT simulation, what you'll do at this point is you want to make sure that your patient is correctly positioned for radiation treatment with their arms up and in correct immobilization. At this point, you could repeat your topograms if you feel that you want to before beginning your CT simulation, because this will be the CT scan that is used for treatment planning. You want to ensure all your SDX equipment is correctly attached. So your goggles are placed on the patient and the nose clip and the mouthpiece. Everything should be for us. We don't really let the patient take a break in between the practice session and the CT simulation scan because it really doesn't take that much longer, but you just want to make sure everything is properly placed. Then you will continue under the imaging tab, and you can begin the program by clicking the play button. At this point, this is when I would bring our mobile laptop behind our treatment wall where you're going to stand as the therapist taking the CT scan. If your SDX computer is already behind the wall, then you wouldn't have to do this part, but this is the point where you'll just communicate to the patient via the intercom through the CT scanner. And then when the SDX system is ready, the words will be displayed that says ready for breath hold at the bottom of the screen. And this is when you can go ahead and you can turn on that green bar or the green circle if the patient is looking at the moon animation, and the patient will be alerted that they can hold their breath whenever they feel ready. And then when the patient does hold their breath, that is when you will start the CT scan. So at this point, this process is not automatic. So you as the therapist will have to manually start and stop the CT scan according to when the patient is in breath hold. But the one thing I'll just mention here is that I normally tell patients this CT scan is only about 20 to 25 seconds. So really patients don't have an issue holding their breath for the entire CT scan after they've just completed the 45-second breath hold because this just isn't as long as what they've just practiced. So that kind of lets the patient know that this scan is going to be a little bit quicker. But again, I just tell patients just because you see the green bar or the green circle doesn't mean you need to hold your breath right away. You can take your time and then go ahead and hold your breath when you feel ready to hold your breath for about 20 seconds. And then just make sure you tell the patient that you'll tell them when they can breathe, because another thing that we've had happen before is the patient will watch the timer at the top of the screen and they'll just breathe after 20 seconds and say that you as the therapist told them that they only needed to hold their breath for 20 seconds. But just make sure that you let them know that that's just an average amount of time that you need them to hold their breath for the scan, and that you'll tell them when they can breathe. And so now moving on to the last category here with moving on to SDX treatment. You'll begin by performing your daily quality assurance. So like you need to do every morning in CT Sim and on the treatment floor, you'll begin by performing your daily QA. Then you want to place the SDX device above the patient's head and secure any wire or part of the device that may come in contact with the gantry when it's moving around the patient. So you can see from the picture that I have included on the screen that we sometimes have to tape up the wire onto our treatment table, because if that wire was hanging down, our gantry could possibly come into collision with the wire, and you just don't want the gantry to possibly pull that SDX equipment off the table. Then you want to verify that the correct patient is loaded on the SDX software, and you can go ahead and bring your patient into the room and position them on the table into the treatment position with their arms up over their head. And you can go ahead and place all the SDX components, so the mouthpiece, the nose clip, and the goggles. And just to mention treatment planning at this point, normally dosimetry does everything that they can to kind of keep the beams coplanar, meaning that not adding really any couch kicks into the plan. Otherwise, it becomes pretty complicated for therapy to have to move the cart in such a way that the gantry doesn't kind of crash into the SDX device, because you really want to keep it above the patient's head at all times. So if the couch is kind of kicked to different angles, it can become pretty tricky. So we really only do that in dosimetry if absolutely necessary. But really kind of the best piece of advice that I have is that try to keep your beam angles coplanar if at all possible. The next thing I'll just mention here is that we had a few patients where physicians were requesting an immobilization device with the patient laying in a mask. So this is just something that I'll share that we kind of had to have custom made for our CT simulation room, and then also for on our machine for treatment delivery, is for tumors that are located kind of in the upper thorax or maybe upper esophagus. We did kind of create this device to allow us to treat patients using the SDX technology, but with the patient laying in a mask. So this technically isn't really released mainstream where you could purchase this, but this at least gives you an idea of something that you could have created for your clinic if you have a physician that is requesting multiple patients to receive SDX treatment with them laying in a mask. And so then beginning with SDX treatment imaging, you want to begin by rotating your gantry to the angle that you're going to acquire your first KV image. So at this point, just like CT simulation, this part is not automatic. So this does take some coordination with you as the therapist being mindful to only acquire your KV and cone beam images when the patient is in breath hold. So you'll begin the SDX program and wait for the indicator that says ready for breath hold. And when it says that, you can go ahead and you can turn on your green bar or your green circle. And when the patient is ready to hold their breath for a few seconds, so take a deep breath in and hold within the appropriate margin. And then this is when you can take your KV. So at this point, I would just be mindful as a therapist to be communicating to your patient pretty well about how long you need them to hold for the specific imaging that you're going to be doing. So for example, our KV images really only take 5 to 10 seconds. So if you kind of let the patient know that, then they know that they don't need to hold their breath for that long. So whenever they see that green bar turn on, they can pretty much take a deep breath in and hold. But then just be sure that you tell them whenever you're ready to take a cone beam, if this is a day that you have to take a cone beam per what the doctor's requesting, that you let the patient know that this will be the longer scan, so that the patient knows that they need to be ready and maybe take a few more regular breaths until they feel ready to hold their breath for as long as the cone beam takes at your specific clinic. I would just recommend stopping the SDX program in between taking your KV images and your cone beam images. Just while you're assessing the images, it kind of allows the SDX program to kind of reset and then you'll just restart the program and have the patient undergo a few normal breathing cycles before taking another image. But after you've taken your KV images, if you are going to take a cone beam CT, I would recommend that you just check your gantry clearance. So you make sure that your gantry start and stop angles are going to be feasible, that with the gantry rotating around the patient, that it's not going to come into collision with the patient's elbows or immobilization device or the SDX equipment. For us, our quickest cone beam is our half arc scan, which is again about 40 seconds. So with this, we just make sure that our patient is properly centered. So meaning that the table is in a correct position where we will capture the patient's tumor volume, but then also what the doctor is requesting for the therapist to align to on the prescription. So for example, some tumors are located in the upper outer quadrant of the liver, but the doctor also wants you as the therapist to align to the bony vertebral column. So you just want to make sure that the patient is centered on the machine in such a way where just your half arc cone beam CT is going to capture the tumor volume, the soft tissue, and the structures that the doctor's requesting for you to align to on the prescription. And then moving on to SDX treatment delivery. This is the part where you'll step out of the treatment room and you'll want to communicate to the patient via the intercom. But just like before, you'll rotate your gantry to your first treatment angle. You'll start your SDX program and you'll have the patient breathe normally for a few cycles until ready for breath hold is displayed. This is the part where for us at our center, we actually have our SDX system linked to our treatment delivery system. So this part is actually automatic for us. So when the machine is ready to deliver treatment and we have requested our beam and we have our beam ready to treat, we go ahead and we press beam on, and the radiation actually does not start until the patient holds their breath within the appropriate margin. So if your system's not automatic or linked to your treatment system, that's okay. It'll just be exactly like you do during the CT simulation, where you'll just manually have to start and stop the radiation beam according to when the patient's in breath hold. And then after the patient's finished holding their breath for the first angle, I would just recommend, again, just like during imaging, just close the SDX program while the gantry rotates to the next angle to kind of allow it to reset. And then you'll continue this process until all of your beam angles are delivered. But the only suggestion I have here is that something that we do is that on our treatment computer, we can see how much of the beam is left to deliver in terms of a percentage. So you can kind of tell a patient that because they really don't know how long each beam will take. So for us, we'll normally say you're at 25%, you're at 50%, and that kind of lets the patient know how many breaths they want. So if they want to break their beam up into 2 breaths, they can wait until you, as the therapist, tell them that they're at 50%, or if you tell them they're at 90%, maybe they'll just try to continue to hold their breath a little bit longer. Otherwise, they don't really know how much beam is left to deliver. So I would just recommend communicating to the patient during treatment and letting them know so that they can kind of decide how quickly or how long they want their treatment to take. So in summary, SDX is a really great option for any tumor susceptible to breathing motion. Knowing how to effectively explain the system to each patient is important. Again, like I mentioned, a lot of patients are really adamant about mastering this technology. So you just want to be mindful as the therapist to be able to provide helpful advice to them in order for them to be able to be a good SDX candidate. Just ensure that the patient has a tight seal with their mouth around the device and that the patient's not breathing into the green bar. This is one of the biggest things I think I would advise, just because this is something that we see. You know, patients really know that that red breathing line needs to be within the green bar. So they do whatever they can to get their line into the green bar, but that doesn't necessarily mean that they're always holding their breath. but you as the therapist just want to make sure that that red line is steady. And that to me just shows that that gives you the best peace of mind that the tumor is probably not moving as best as possible. And then just be sure you communicate to patients how long they need to hold their breath for each requested time. That kind of makes sure that you don't need to repeat any imaging. For example, if they don't know that you're about to take a cone beam CT and you need them to hold their breath for a long period of time, and they think it's just another X-ray that only is 5 seconds, they might not be ready to hold their breath. So just make sure that you as the therapist is adequately communicating to them how long you're wanting the patient to hold their breath for this particular time. And then lastly, just that the imaging and treatment delivery takes some coordination with the SDX system. So some parts of it might be automatic, but some parts of it is manual. So just make sure that you're only taking your images when the patient is in breath hold, whether that's the CT simulation scan or whether that's your images before daily treatment delivery. And then that is the end of my presentation. So I'm happy to take any questions at this time. And this is also my contact information. If you guys have any questions that come up that maybe come up after this presentation, if you guys are using the SDX technology or anything that I didn't cover today, feel free to email me and I would be happy to help out in any way that I can. Thank you all for listening.
Thank you, Kara. That was a great presentation, great feedback. So we do have a lot of questions in the chat. I'm going to read them. The first one was, how long do you schedule an SDX CT for, to include the teaching time and then the SIM time?
Yeah, so that's a great question, but our total SDX practice session and then SDX simulation is a total of 2 hours.
Okay. What would you do if a patient cannot hold their breath for 45 seconds?
Yeah, so this is normally something that we kind of leave up to our SIM therapist to kind of make at their discretion. Normally, if a patient's pretty adamant that they really want SDX, their doctors really talked this up, and the patient's just absolutely convinced that this is the best thing for them. If they're at least achieving 35 to 40 seconds, we'll normally pass them through and just let them know that they probably need to go home and work on holding their breath for 40 seconds in between the CT simulation and treatment. Because again, I explained that it's only for the purpose of obtaining the imaging that the doctor's requesting. So that would be our cone beam CT scan. But some patients, really, you can kind of just tell that SDX is going to be just a pretty big burden on them coming in every day for treatment, and that they're really not a great candidate. So if they're really just not holding their breath for very long at all, if they're really only holding for 20 or 30 seconds, and they're just really not probably going to be able to do very well during the imaging, we just probably will look into other options of compressing their breathing motion with other options and not SDX.
Mm-hmm. Yes. Will you share this PowerPoint with the audience?
Yes, yeah, I can send it to definitely whoever.
Okay, so I suggest that for the ones that would like to have this presentation, just reach out to Kara directly so she can share it with you. And then we have another question about the typical delivery time for a field. What's the typical delivery time for a field? Does 45 seconds cover the field delivery time? Do you encounter numerous pausing during the beam delivery?
Yeah, so that's another great question. It really depends how many beams we break the treatment plan up into. So if the patient only has 2 beams, then there's probably a pretty good chance that the patient can't hold their breath for the entire beam. However, if the patient's getting 4 or 5 different beams, they might be able to hold their breath for the entire time. But that's really where I recommend just talking to your patient and letting them know how far they are in terms of percent, so that they know how they want to break up the beam according to how they feel with holding their breath.
Okay. And then what would you say is the biggest challenge that you face with the SDX at this point?
I would say that probably the biggest challenge is just the patient not having a tight seal with their mouth around the mouthpiece. So again, like I feel like I mentioned a few times throughout the talk, is just to make sure that whenever you are doing the practice session, that you're kind of watching the patient's mouth. And it's pretty normal for at the end of the hour-long practice session to kind of see the patient's like lips be like really kind of weak, or that, you know, you definitely like wore out their muscles because they have a tight seal the whole time. But you know, if the patient is at the very beginning having trouble keeping a tight seal, that's like probably a pretty good indicator that this is just going to be a struggle for them for treatment. But that's probably the biggest thing that we see, that's the biggest struggle for us.
Okay. Then we have a technical question. Is it possible to resume the CBCT on the ProBeam system to avoid having to repeat the CBCT from the start if the patient falls out of breath hold?
Yes, so it is possible. We actually really never do that. Again, we really only pass patients through the practice session if they can hold their breath for 45 seconds, because again, we really determined that the best image quality is when we can have the patient hold their breath for the entire cone beam CT. But that definitely is an option. So you as the therapist would just have to really be watching, and you have to stop the scan the second that the patient falls out of breath hold. And then you want to start the scan again right as the patient goes into breath hold. Of course, they could be in a slightly different position, so we really try not to do that. We don't know like how well we trust that. Again, we're trying to be super accurate with using SDX because the treatment margin is extremely small because we're not really accounting for any motion. So you certainly can do that if a patient's really adamant about using the SDX technology, but just can't hold it for your entire cone beam. But again, we really don't do that often. We can normally get patients pretty much all the way through the cone beam. Even if we have to stop it a few seconds early and miss like a few slices at the very end, we feel like that's at least a little bit better than letting the patient breathe in the middle of the cone beam CT scan and then resuming it.
Okay. Okay. Do you know how the physicians sign off on the breath hold review daily?
Yeah, so we, if I'm like understanding that question correctly, we just have our physicians approve our images at the end of every day. Okay. And then of course we don't treat them the next day until the physician has approved it from the day before. Unless it's their first day of treatment, then we'll have the physician come and make sure that they look at the images before we start treatment. Okay.
We do have another question about the use of surface gating systems. Do you use both SDX and SGRT device?
Yeah, so we actually do have Vision RT at our clinic, but we do not use them together. We don't use SDX and Vision together. We actually don't have, we have both systems in separate rooms, and so we don't even have that capability, but we just really pretty much use SDX as our primary method for if a patient's going to hold their breath. Even if they're SBRT, we'll just simply use, like, make sure that the patient's breath is within the appropriate margin during our imaging and then treatment delivery, and not use it in conjunction with like other surface guided modalities.
Okay. We do have other questions. Is planning process different, unique for breath hold compared to other systems, for example, the RPM?
Yeah, so that's a great question. Our treatment planning process isn't too different. The biggest thing that I would say is that for like the RPM system, we would be using one of our breathing phases to plan our SDX treatments on, or sorry, our regular free breathe treatments on, but then our SDX, for our SDX plans, we will just use our breath hold scan to plan the treatments on. So it's actually a little bit simpler because of course the doctor just has to draw their treatment target volumes on one scan, instead of all the different phases of the breathing cycle. So it actually makes it a little bit easier for the physicians. For dosimetry and treatment planning, it's not too much different. There's a few like technical components that you have to do, like you have to check motion synchronization if you are using the SDX technology. But I will say for us, we actually still, any SDX patient, we still generate a free breathing plan as well. So we actually do 2 plans in total and acquire 2 CT scans as well. The one with the patient holding their breath using SDX, and the other with the patient free breathing using the RPM system. And that's just in case our SDX system goes down, the patient could still receive treatment that day and not have to miss a day of treatment just because our SDX system is not working that day.
Of course. We do have a question regarding the new version of the software. Have you been observing patients preferring the new goggles versus the software view? Do they prefer the moon or the curves?
Yeah, I think it's pretty split. I think we now just automatically kind of start with the moon because we kind of figured that SDX kind of came up with that because they think that that's probably simpler than the patient's breathing line and the green bar. For me, I start typically showing the patient the moon animation, but if they're starting to get confused, I just go ahead and switch it. I think I was pretty comfortable for a long time explaining the line and the green bar. So sometimes it's easier for me to do the coaching session with that view, but I think that the patients really do like the moon animation.
Okay. I just want to mention that we also have a newer version for the software, which basically consists in a flying dragon. So if you want to see like a video of this new software application, it will be available on our YouTube channel as well. We do have a question from Amy that's asking about, is your practice session and CT both in the CT room?
Yes, so it is. We do our practice session with the patient laying in the exact same position that we want for treatment. So we'll have them laying on our CT table in their back lock or their immobilization device so that we can kind of do the practice session and kind of simulate it in the exact same way that treatment will be in.
Okay, I think that's the case for the majority of our clients, especially in the US. Do you have any particular treatment beam planning protocol for SDX? This person wonders if there's any limitation, example, limited gantry angle or table position.
Yeah, so I don't think we have anything specific for SDX that's out of what we would have for any patient that we're planning. There's a few gantry angles that we cannot use for treatment planning. But the only thing I would mention that I kind of mentioned briefly during the presentation is just that we try not to have any couch kicks if possible, just because it's a lot simpler for the therapist and just a lot more reproducible in terms of obtaining images if the patient just kind of stays without any couch kicks.
Okay. We have one of our SDX user that's asking, what is your practice if you find that the patient breathing has changed between SIM and the first fraction, such as the CBCT does not match?
Yeah, so that would be something that we would probably have to get physics and our physician involved in pretty heavily, because we would have to just make sure that the margin, so like the green bar that is 75% of the patient's maximum breath hold, that first of all correlated correctly from the CT practice session to the treatment machine. So we would make sure that value is correct. And then we would probably repeat our imaging just to make sure that that the patient wasn't for some reason holding their breath too high or too low above the margin or not, because again, this is not automatic. This is something that the therapists manually do. So I would just recommend repeating your imaging to make sure it just wasn't something that was just different for that particular scan. But if the patient really wasn't setting up according to how they were scanned, we would probably do something where we would just take our patient up to CT. We would repeat a scan upstairs with the patient in breath hold. And then we would send that scan to our treatment planning computer and kind of overlay it and compute the dose on it and see if it's making any major difference to the treatment plan.
Okay. All right. So we do have some time for more questions. Feel free to write them in the chat. I will also put my contact in the chat, just in case you would like to reach out directly to DYN'R. So we have more questions actually coming up. For the newer goggle view moon animation, does it display if the patient inhales above the desired level?
Yes, so their moon animation could go higher than the green circle. And again, you would just, as the therapist, kind of coach the patient to let a little air out. And that green circle will turn blue once the patient is in the appropriate margin.
Do you ever do SDX and not image daily?
No, we always take at least a KV X-ray, and then probably 90 to 95% of our patients are cone beam daily for SDX.
Okay. And Amy is asking if you ever used SDX for breast treatment.
Yes, so we can do that. Our current practice at our clinic is to not use SDX for breast, mainly because the beams would take a very long time. But if we feel like for some reason the patient has really unfavorable anatomy and that they could really benefit from holding their breath and kind of bringing their heart away from their breast or something like that, we could use it for breast treatments.
Okay. I still see about 50 people connected, so I'm sure you guys have questions. Feel free to use the chat and to use as well the email that Kara provided if you have any questions that you would like to ask her directly. All right, I think we're gonna close this presentation. Kara, thank you again. If you have any word before leaving, the scene is yours.
All right, well, I don't think so, but thank you for everyone that joined. I hope you found this helpful. And like I said, definitely reach out to me if you have any questions that come up, and I would be happy to help.
All right, thank you very much, everyone. We'll see you at PTCOG in Madrid. Have a great day, everyone. Bye-bye.